So thank you for this kind introduction. And thank you very much for the organization. I'm very happy to be here in London. I'd like to thank Dr. Halper for his great effort in organizing this Congress here in London. I will talk about 10, 12 minutes about our experience in skin cancer, but not our experience, but what I think teledermatology has how has improved skin cancer management delivery. After more than a decade working with teledermatology and skin cancer, what started as the internet transmission of clinical picture using email has actually changed how we provide care in many fields of dermatology, as we have seen this morning, but in particular in skin cancer management. The World Health Organization considers e-health and also telemedicine as an excellent tool to face the key issues that healthcare struggles with, both in developed countries but also in underserved areas, that are access, equity, quality, and cost effectiveness. In my view, what teledermatology has provided is a better, higher standards of quality to the care we provide for skin cancer patients. Let's see what does quality means. Quality of care is doing the right things at the right time for the right people and doing them right the first time and efficiently. Among the many definitions of quality and many meanings of quality of care that you may read, I find this definition issued by the Department of Health of the United Kingdom in 1997 one of the most pragmatic and clear and specific ones. Over the following minutes, I will try to show you how teledermatology completely meets all these requirements of quality of care. Let's start with time. At the very beginning, one of the essential rationales to develop and to implement teledermatology programs in skin cancer was to shorten the truly long times to access to the dermatologist those days. Shortly after the first programs began, the dermatology was shown as a more timely care, to provide a more timely care. These are some of the studies addressing this. What we see is a clear time advantage of the dermatology programs, both in different experimental and clinical settings, both for general uses, general dermatology uses, and also for skin cancer management. So it's a remarkable achievement of teledermatology. However, does this shortening in waiting times have a real effect on the final outcome of patients? Of course, for sure, yes. However, not directly and not in the short term. Let's see. This is the sequence of events that happens from a skin cancer develops. This is first noticed by the patient, seen by the family doctor afterwards, and finally diagnosed and treated by the dermatologist. In skin cancer, this sequence, this timeline may be rather long, especially in this left part of the sequence. Shortening of waiting times through using teledermatology works directly on this time period, a period of time that may be even considered proportionally negligible if we compare it with the whole sequence. So, with teledermatology working on these waiting times, we are just improving, we're just doing that patients who decided to go to the family doctors, we are providing these patients with a faster access to the dermatologist's opinion, which is no small thing, of course. If we go to the long term, this is our 10 years since the very beginning of our teledermatology program. The shorter the time to get access to the dermatologist, the greater the number of teleconsultations requested. So teledermatology has not only reduced the workloads of dermatologists, as the detractors initially claimed years ago, but it also increased the number of patients seeking care for any type of skin lesion. This has been associated with a roughly twofold rise of the frequency of basal cell carcinoma. This is striking, increasing in such a short epidemiological time cannot be explained completely just by a real increase in basal cell carcinoma incidence. And this has come together with an increasing trend line in precancerous lesion more recently. You see here, actinic keratosis, actinic cheilitis, and also an upward slope in the trend line of thin malignant melanoma in situ anti-1 malignant melanoma, as you see here. So, teledermatology has worked on this right part by shortening time to get a final diagnosis and treatment, but we also believe that with teledermatology, teledermatology also worked on this part. We believe that patients who might never have sought dermatological care under the former healthcare delivery are now seeking and receiving care at their very own neighborhoods. So the better the access, the more people seeking care for any type of lesion. And we think that this is allowing us to improve, to detect, to treat skin cancer at an earlier stage than at least 10 years before. Doing the right things for the right people. In other words, delivering the care that a certain patient really needs and no other. Is there any need? Does this patient with this long-lasting, clear-cut, common acquired melanocytic nevus really needs to be seen at a skin cancer clinic? Could be this elderly lady to be initially treated with topicals by her family doctors with our remote assistance? And furthermore, is there any point in making this elderly lady to go to an in-person visit instead of referring her directly to a surgery room? What I mean is that teledermatology allows the selection of patients who really needs to go to a skin cancer clinic, keeping these other patients with banal lesions away from the hospital, but after taking a specialized opinion. All these patients are also seen by a dermatologist. With teledermatology, we may readily identify those patients who need a faster referral. So a proper prioritization is possible with teledermatology. And finally, teledermatology allows a better allocation of patients, like at our presurgical teledermatology program, so attempting to resolve the patient's problem, avoiding as many inconveniences as possible, especially for patients with physical limitations. So teledermatology is an excellent tool that enables us to deliver an individualized care for each patient. So, placing the patient at the very center of the process, which is patient-centered care, another requirement of quality of care in other definitions. Talking about patient-centered care in teledermatology, we should mention the most recent use of methodology of telemedicine and teledermatology, direct-to-consumer teledermatology. The wide availability of mobile technologies has enabled patients to generate their own pictures for diagnosis or even monitoring their skin conditions. In skin cancer management, mobile teledermatology, direct-to-consumer telemedicine has been particularly applied to help in self-examination and follow-up, teledermoscopic follow-up of patients at a higher risk of having malignant melanoma. This study determined the acceptance of patients with this sort of devices. Most patients found that dermoscopy was taking pictures, dermoscopic pictures was easy, was not difficult at all. And even self-teledermoscopy even enhanced the motivation of the patient to complete self-examination, which is a very good goal. However, whole body examination were less easy to complete, and however, 65% of the patients didn't experience any problem when taking pictures from their moles or skin spots. So these others concluded that despite high levels of acceptance of the dermoscopy, practical issues, especially related to handling the dermoscope and handling the smartphone, need to be resolved before a more widespread use of patient-initiated teledermoscopy. In this other study, the authors assessed the feasibility of patient-initiated or patient-driven teledermoscopy for the short-term monitoring of clinically atypical nevi. In this study, 97% of the patients with a sample size of 29, 97, almost all the patients, were able to take evaluable pictures. The concordance with respect to conventional dermoscopy at the in-person visit was pretty good, like 87%, and they also reported a high receptivity by the consumer, by the users. So these authors concluded that patient-driven teledermoscopy was a feasible and effective method for the short-term monitoring of clinically atypical nevi. In my opinion, we should expect for further studies based on prospective and larger series before implementing this sort of devices in our routine practice at our pigmented skin, pigmented lesions clinics. Teledermatology has also shown, we have seen a lecture on this topic, because teledermatology has also shown to be an efficient way to provide an efficient approach to deliver care in dermatology patients. This recent systematic review on this topic showed that most of the store and forward teledermatology programs were more cost-effective than the conventional alternative, with savings that were variable depending on the perspective of the economic analysis, but in any case, savings that were meaningfully, were significantly with respect to the conventional alternative. Even in our experience, we have observed that even teledermoscopy is a more cost-effective alternative to deal with skin cancer screening, mainly due to the striking difference in effectiveness in favor of teledermoscopy. So it's the dominant strategy to screen skin cancer patients. I'd like to end my talk with this paper that mentioned, others have mentioned, the three promises that teledermatology to provide cheaper, better, and faster dermatology care, which is rather similar to what we are mentioning about quality of care. The interesting thing is that these authors analyze the factors, the key factors that will come through these promises of teledermatology. In this study, these are some of the studies evaluating screening system for skin cancer with the face-to-face referrals avoided and the sample size. These authors found that those programs, the teledermatology programs, especially for skin cancer with yielding the best results, should reckon on at least one of the following attributes of our intervention. The first, preselection of the patients. That refers to the need of a set of criteria to decide which patient should go to teledermatology and which patient should go directly to conventional care. These authors found that the most successful teledermatology programs, these inclusion and exclusion criteria, are usually applied by a primary care provider with a specific training. Second, these authors also found that working with high-quality pictures, and in the case of skin cancer with teledermoscopy, is of utmost importance to ensure the effectiveness of the screening program. And finally, these authors also mentioned that any teledermatology program, at least in well-served areas, must rely on infrastructure able to deal with patients who need an in-person visit with a dermatologist, management by the primary care provider, or just a surgical room. So the possibility to immediately launch an in-person visit is of utmost importance for the success of teledermatology program. So this was all I wanted to show you, to tell you. Apart from the papers and reviews I've mentioned, you may find many others papers and studies supporting the role of teledermatology for skin cancer management. After more than a decade of teledermatology for skin cancer, I think that teledermatology is much more than the use of the technologies to avoid or to speed up referrals of patients with skin lesions. I think that the real achievement of teledermatology in skin cancer patients is under this quote, because teledermatology really does the right things at the right time for the right people and efficiently. And this is a real, might look a bit simple, this quote, but this is a quote that had never been previously met by conventional approaches to skin cancer patients. Thank you very much for your kind attention.